combined with nutritional and hormone deficiencies, which are rampant. 90% of the world's population is probably deficient in magnesium and selenium. We as humans have lost the ability to produce vitamin C, unlike the animals. And this is the reason why they can harbor the virus and they don't suffer the consequences. This is why you look at animals, they don't get dengue, SARS, and Zika, and cancer, whereas we humans do. So this very simple fact, if it is given out, if it is mentioned to everybody, then everyone will be taking vitamin C. And you can do a lot of good. Why is this not appearing in the media? Now, besides that, besides vitamin C, our inability to produce, we are also very deficient in almost all valuable nutrients, because the soil is deficient and there's a lot of pesticides and chemicals which will deprive your plants from absorbing what is in the soil. And we are also becoming increasingly deficient in hormones. From the age of 25 to 30, the hormone deficiency is already seen. So all this have weakened the immune system in the young, including the newborns and the children. Now, why do I say newborns? Is because I've been practicing obstetrics and gynecology for a long time. As an obstetrician, when I studied hormones and I introduced hormone therapy in the antenatal care, especially the thyroid hormones, the outcome of the pregnancy was phenomenally different. There were less miscarriages, less preterm deliveries, less neonatal jaundice, better lactation, but the thyroid hormone ensured that the mother delivered a baby who grows up into a child with stronger immune system. Many of the young children now are sick because of maternal hypothyroidism. So we need to understand that we are living with nutritional deficiencies. We are living with a lot of hormone deficiencies. And this coupled with wrong choice of food. Now, what we need to emphasize is this: the increase in the consumption of refined foods and carbohydrates, especially sugar and gluten, has weakened the immune system. Because when you eat sugar, I'll mention it again, your insulin goes up, and high insulin levels is detrimental to health. And unfortunately, the newborn is already exposed to sugar, because this is what you see in bottle feeding. So high carb diet and sugar, refined foods, all these have created a lot of problems. So you cannot prevent the virus from attacking us. And virus is a survivor. So it will keep mutating itself in order to survive. So how do you want to fight all these epidemics and pandemics? The idea is to prevent. The idea is to reverse it if you have already got infection. So you'll have to look at this. And the change in lifestyle, sleeping late, and gadgets which emit electromagnetic frequencies, which you'll look at. All these are the reasons why the immune system is weak. So the focus in preventing an infectious disease, let it be virus or bacteria or fungus, is your immune system. That is your defense. So we should be talking about the immune system and less of drugs and vaccines. So let's look at the immune system. This is a brief introduction only. Now you have three systems when it comes to your immune health. One is your innate immune system. The other is your adaptive immune system. And interlinking these two is your interferon. Okay. The innate immune system is the first line of defense, and it consists of macrophages, neutrophils, dendritic cells, natural killer cells. Your adaptive immune system consists of your B and T lymphocytes. And your intermediate is with interferon 1 and 2. There is a lot of connection between the innate and the adaptive, and there is also a lot of communication between the innate and adaptive by the interferon. So you need to keep your immune system robust. And what do your immune system ask for? They ask only for natural nutrients. They only demand for sufficiency in hormones. They are not asking for drugs. They are not asking for vaccines. So macrophages offer the first line of defense. When a foreign pathogen gets into the body, the defense is the macrophages, because it will engulf the pathogen, produce cytokines, produce interferon, and it also alerts your adaptive immune system. Those are the B and the T lymphocytes. And macrophages produce cathelicidin. This is an antimicrobial substance produced by macrophages. All this help to kill the pathogens once it's engulfed. And cathelicidin can only be produced if you have sufficient levels of vitamin D3 in your body. So if you have, say, for example, if you are deficient in vitamin D3, your ability to produce cathelicidin will be low, and your ability to kill the pathogen, even if your macrophages engulf, will be low. Then look at cytokines, for example. The cytokines are necessary to kill the pathogen. This is a balanced inflammatory response. So this is controlled. And if you are deficient in vitamin C, for example, and if you allow the virus to get into your body and if your macrophages are not functioning well, if your vitamin C is not sufficient to kill the virus at that spot itself, then the virus, as I mentioned, it will split your hemoglobin. Once the hemoglobin is split, then there is an acute deficiency in nitric oxide. Once you are low in nitric oxide, there is another problem. Your macrophage can overreact. Then they can produce excessive amounts of cytokines. So the balance will be lost. And all of us would have read that in COVID-19 or SARS-CoV-2, the disease, there is excessive cytokine, which is known as cytokine storm. So why would your body produce too much of cytokines and too much of inflammation? Is because your immune system has become dysfunctional, and you cannot correct a dysfunctional immune system with drugs or vaccines. You need the natural ingredients or natural molecules. So macrophages provide the first line of defense to engulf and kill the pathogens. They also communicate with your adaptive immune system. Then neutrophils, they also phagocytose the pathogens. They activate the NADPH complex to generate reactive oxygen species. Now, oxidative stress, controlled oxidative stress, controlled inflammation is necessary to kill the pathogen. This is necessary only when it is overwhelming. So neutrophils do that. They also generate proteolytic enzymes that will lyse the cell wall of the pathogen and kill them. They generate cytokines. They also synthesize interferon gamma that regulate the macrophage activation. So there is a lot of interplay. Once you have macrophages, then you activate your neutrophils. Neutrophils will in turn activate your macrophages again. And there is also immune cell recruitment. And there is activation of adaptive immune system. So your innate immune system constantly keeps in touch with your adaptive immune system. But your innate immune system's reaction is very fast, whereas your adaptive immune system that consists of the humoral and the cellular immunity, it's slower to work. So you still need the first line of defense. And the first line of defense is all supported by the nutrients I mentioned at the beginning. And we should do a webinar on optimizing immune health with nutrient therapy. We can look at it at another time. Now, dendritic cells, these are bone marrow derived leukocytes, the most potent antigen presenting cells. That means dendritic cells will just hold on to the antigen and present it to your adaptive immune system, so they respond. So, and they play an extremely important role in initiating immune memory and differentiation of your Th1, Th2, and Th17 cells. Dendritic cells also secrete TNF alpha and interleukin 12. They will act as anti-inflammatory agents. One dendritic cell can stimulate anywhere from 100 to 3,000 T cells. Now, this is why dendritic cells are used even in some cancer therapies, because they are useful. But remember, you can actually have adequate dendritic cells and have them healthy and functioning well if you optimize your nutrients and hormones in your body. Natural killer cells, as the name goes, they are very good at killing. Now, this is part of innate immune system, and they play also a very useful role in the adaptive immune system. They recognize the histocompatibility signals to distinguish between healthy and target cells. So if you have natural killer cells that are functioning well, they will be able to differentiate your healthy cells and the cells that are infected by the pathogens. And once they are activated, they secrete several cytokines, and they also secrete what we know as GM-CSF, granulocyte macrophage colony stimulating factor. So every cell in the innate system plays a very crucial role to give you the first line of defense. Interferons, they are part of the intermediary. That means they augment the communication between the innate and the adaptive immune system. They are cytokine mediators that alert the system, especially the adaptive immune system, and they possess very important antiviral properties. And some of you may have heard about interferon alpha that is being used in cancer and some infections. And actually, Glaxo actually had produced interferon 1 alpha. And if it is available, then it will be a good therapy for those who are moderately or severely infected with COVID-19. And apparently it only costs $2 a day to treat a patient. But this is not in production anymore for reasons only known to probably CDC and NIH. Now, type 1 interferon is alpha and beta secreted by the virus-infected cells, because once the cells are infected, they produce interferon. The type 2 interferon, the gamma, is secreted mainly by the T cells and the macrophages. So interferons are very important. Now, once you have a pathogen in your body, and say if your innate immune system is functioning well, your adaptive immune system is functioning well, and you will have natural antibodies. Now, these are natural antibodies. They neutralize the pathogen, they phagocytose, then they produce antibody-dependent cytotoxicity. They also produce work with complements. That means once the adaptive immune system is activated, they produce the complements which will also lyse the infected cells. But at the same time, the natural antibodies can also work without the effector cells promoting a reaction. They can work actually independently. Now, if you have natural antibodies, then your inflammatory response is controlled. Now, remember I mentioned that if you have a dysfunctional immune system, and if you have excessive macrophage action, if you have a cytokine storm, that's what puts people into trouble. So let's talk about immunosenescence. As I mentioned, hormone deficiency is seen from the age of 25 to 30 onwards. So when hormones are declining, it shouldn't be surprising to any one of us if we say that we are aging prematurely. That means including your hypothalamic pituitary axis. That means the thyroid is going to be affected, your adrenal gland is going to be affected. So all these are going to be affected, the hormone secretions. So you have thyroid deficiency, you can have thymus atrophy, you can have adrenal insufficiency. So this is part of aging. Now, immunosenescence, aging, part of aging, yes, but then the point I'm trying to drive at is because of our diet, our lifestyle, our sleep patterns, nutritional deficiencies, hormone deficiencies, we are aging prematurely. This is what we need to take the message. We should address premature aging. Sleep and stress affects your adrenal glands especially. Now, the problem is the sleeping time. Now, we have a natural circadian rhythm, which should be early to bed and early to rise. But unfortunately, including children, we are sleeping very late, and that disrupts your circadian rhythm. Number two, the use of electromagnetic gadgets, handphones and computers and laptops, and these emit blue light, and that blue light disrupts your melatonin secretion during the night, so you are not able to sleep, and it disrupts your adrenal function in the morning, which means instead of producing the hormones that gives you the energy, the focus, the attention, the drive, your cortisol, your DHEA, in the morning, they only recoup themselves to produce later part of the day or in the evening. And when you have too much of these hormones in the later part of the day, again, it's going to disrupt your sleep. So it becomes a very vicious cycle. So sleeping late and having unnecessary and excessive stress, unbalanced stress, positive stress is okay, short-term stress is good, but chronic stress is definitely a negative factor for your immune system. This is a simple example is if you look at diabetic people, they are more prone for cancers. If you look at patients who have depression, they are also more prone for cancer. It is all because it's connected to your immune system. So this also accelerates immune aging. As I mentioned, high carb diet, especially sugar, insulin connection, insulin resistance, and the onset of diseases. Now, insulin in healthy amounts is absolutely critical for health. We will look at how insulin helps and why insulin disturbs your immune system. But when insulin is excess in your body, this is detrimental to every cell in the body because insulin is highly inflammatory. Okay, highly inflammatory. So once you have chronic or chronic silent inflammation, everything breaks apart in your body. Besides the inflammation, insulin also increases weight, so it leads to obesity. And once you have obesity, you also have an increased risk of diabetes, and it becomes just a vicious cycle. So high carb diet, including children, is the reason why COVID-19 is seen in children as well. And it is, to me, it's funny to think that the virus is going to be selective against age or your caste or your creed. No. Virus will get into someone irrespective of who you are. And as long as your immune system is weak, it's going to start growing. But of course, the old and elderly and those who have comorbidities will have a higher risk of serious illness. Now, deficiency in antioxidants, we are not going to go into the details, but let me emphasize the master antioxidant within your cell is still glutathione. There is a big difference between glutathione and vitamin C. They work as fantastic heroes when you put them together to prevent you from getting a pathogen in your body and say viral infection. Glutathione, vitamin C, vitamin D, magnesium, they're all critical, including zinc and selenium. But nothing beats vitamin C in high doses when you're already infected. So you maintain the rest of it. What matters, what makes the difference between somebody who fights the infection and somebody who doesn't? It's the amount of vitamin C you give it to them when they're sick. So we can look at how to dose vitamin C for optimum health prevention, and how to use and how much of vitamin C to be used when someone is sick. but they are antioxidants. So you have to talk about intracellular antioxidant, you have to talk about water-based antioxidant and lipid-based antioxidant. So all these antioxidants, we are deficient. Okay, there's a difference. Vitamin C, we don't produce at all. Everything else, we are deficient, even if we produce. Now, we are also deficient in minerals, especially magnesium, zinc, selenium, and iodine. Magnesium does hundreds of functions in the body. Zinc and selenium are critical for immune health. Iodine is necessary for your thyroid function. Are we deficient? Yes, most of us are deficient because that's what the soil is nowadays. Unless you live in a pristine world, grow your vegetables in an organic soil free of pesticides and chemicals, we are likely to be deficient in minerals. You cannot have a strong immune system when you're deficient in nutrients. Deficiency in vitamins, especially vitamin A and vitamin B. And I mentioned about the blue light. So these are the reasons why our immune system is aging. Now, once you have immunosenescence, it's going to affect both your innate and adaptive immune system. There will be a decrease in natural killer cells. There will be a decrease in macrocytes and granulocytes numbers and function. There will be decrease in interferons and increase in CD3 and CD4 counts, which means you are likely to have more cytokine production and more inflammation. Now, let's talk a little bit about the current pandemic. You'll get a better understanding why nutrients and hormones are important before I go to the hormone discussion. Now, it should be SARS-CoV-2 actually is not the disease. The disease is a different pathology. COVID-19 is just the virus. Why people get sick and die is not because of the virus. It's what happens in your body because of a dysfunctional or weakened immune system. So what happens in your body is you have a weak immune system, a dysfunctional immune system, and you have an overreacting immune system. That's what immune system does when it is dysfunctional. It just is not able to recognize a friend and a foe. So when you have overreaction, there is a cytokine storm, and there is also associated acute and severe inflammation, which can be controlled by either synthetic anti-inflammatory or you use all the natural anti-inflammatories, especially vitamin C in an acutely infected patient. There will be excessive free radicals and oxidative stress, and so you need antioxidants. Drugs do not do this. Drugs are not antioxidants. Vaccines are not antioxidants. And anti-inflammatory drugs can control your cytokine storm, but of course, all drugs have their side effects. So do we have natural solutions? We have plenty. So SARS-CoV-2 is not a disease. The COVID-19 causes only the infection. The SARS-CoV-2, the pathology is caused by a dysfunctional immune system. So addressing the immune system is how you play the game. So the treatment, ideally, if you want to do justice to health, first you fix the immune system. And you can only fix your immune system if you let the body have what it is asking for. It is asking for nutrients. It is asking for hormones if you are deficient. And it's asking for a healthy diet and healthy lifestyle. Address those. This is prevention. And that should be the treatment. And every other supportive treatment in someone who needs, like heparin for somebody who has hypercoagulable blood, that's fine. But address the core issues. You have to fix the cytokine storm and the inflammation and the free radicals as well as the oxidative stress. Now name me how many drugs can do this and whether any vaccines can do this. Why am I emphasizing this is you must be alerted to what actually you can do to allow the body to either prevent or fight it. There is no need to have sufferings, and deaths. So the pathology in SARS-CoV-2 is increased inflammatory markers, TNF-alpha, interleukin-1, 6, and 15, and there is a decrease in interferon-1 alpha. So drugs, except for anti-inflammatory effects, they don't seem to have much beneficial effects, except side effects. Now, they do not work on your innate and immune system. As I mentioned, they do not help you to increase your interferons. They don't control your cytokines unless there's anti-inflammatory action. They are not antioxidants, so they are not going to control the oxidative stress. If you read what happened in that at the beginning of the pandemic, actually, because we are still very confused about the whole virus, everything that happens in the body, we are still confused. Initially, it was supposed to be acute hypoxia, so patients were ventilated. Then we found that ventilation actually kills in some. Actually, it was detrimental in lots of patients. So now it is just nasal bronch oxygen or like a head box oxygen, because that seems to do better for the patients rather than positive pressure ventilation. So we went wrong. Then we realized that it's not hypoxia, but there is also hypercoagulability. And now we know that it affects blood vessels, and it seems to be affecting the testicles, the spermatozoa. This is not surprising because the virus is unlikely to choose a particular organ. It prefers certain cells, but it can be systemic. We should be prepared for it. So if you want to look at drugs that address all these issues, then you must fix the causes. You must fix the pathology. This is where natural treatment is far better. Now, coming to vaccines, there is also a big rush to develop vaccines, and the world is hoping, and they want us to believe that vaccines will save lives and save economies. But I am not so sure about this because COVID-19 is an RNA virus. If you look at the Cochrane study, this is a database, which is a very reliable database. If you look at the Cochrane research database, the success rate of H1N1 vaccines is probably around 2%. And why are we vaccinating them on a yearly basis? Because of mutations. So you should anticipate a mutation and you should prepare yourself, the vaccine, to be ready for the next mutation. Now, tell me, how is it possible that you anticipate what is the virus going to mutate into? Now, RNA viruses, their propensity to mutate is high. That means they will mutate fast. And as you know, there are so many strains already of this COVID-19. So how a vaccine, which is aiming at a target, is going to hit all the moving targets? So that means if you have mutated strains, how could a vaccine be effective? And why are we hoping that vaccines will be the panacea for all viral infections, or at least this pandemic, or any other pandemic that is going to come, or epidemic? Sad, but this is true, because you cannot run away from this. If you are weak, every virus is going to cause either an epidemic or a pandemic. That's what is going to happen. So virus cannot hit, vaccines can't hit a moving target because they mutate. They also bypass the first line of defense. I told you the macrophages, the neutrophils, the natural killer cells, the dendritic cells, that not only kill the pathogen at entry, and they also prime your adaptive immune system, either directly or through interferons. All these functions, you can't have it. And they do not control the underlying pathology. I mentioned about free radicals. I mentioned about oxidative stress, cytokine storm. Now, this is not going to be controlled. And vaccines, they contain heavy metals, especially aluminum and mercury as preservatives. For those who are interested to read about the possibilities or the side effects of vaccine, maybe you want to explore some of the websites, and you can read about human genome and the retroviruses, And is there a connection between vaccines and retroviruses that could be activated? Now, it is a good reading. Please read and be well informed before somebody comes knocking on your door to vaccinate yourself or your children. Better have the facts right. Now, coming to hormones, there are many hormones. Now, you look at here in this slide, I have thyroid hormones, DHEA, cortisol, melatonin, insulin, prolactin, and I also have on the next slide thymosin and IGF-1. But for today, we will just look at thyroid, DHEA, cortisol, melatonin, and insulin. We won't have time to cover all the rest of the hormones. We can always cover another time. Now, thyroid is particularly interesting because this is one hormone that decides whether you are creating a healthy generation, next generation, or you're going to create a sick child. Now, thyroid hormones, the maternal thyroid hormone level decides the health of pregnancy. As I mentioned, miscarriages, premature deliveries, macrosomia, poor lactation, neonatal jaundice, respiratory distress syndrome, children who perform poorly in school, children who have weakened immune system and they are frequently sick, and unfortunately they're all treated with antibiotics, with yeast overgrowth, and girls especially, delayed menses, scanty menstrual flow, infertility, and again pregnancy losses, children having kyphosis and scoliosis. All this is related to maternal hypothyroidism. So if the mother is hypothyroid, the child is likely to be hypothyroid, and that child will be frequently sick. So unless you address these issues, you can't prevent sometimes certain viruses from infecting them and giving a lot of problems. So a strong immune system depends on hormones as well, and thyroid plays a very crucial role in our immune health. Someone who is hypothyroid, even an adult, will have more allergies and frequent infections. The reason for hypothyroidism, mother to the children, gluten and soy, they can affect thyroid health. Unfortunately, the amount of soy consumed now is in excessive amounts. Everybody is drinking soy. It is an goitrogenic, not only goitrogenic, too much of soy also gives you a lot of estrogen. That is not so good. Iodine deficiency, as I mentioned, is very common. Most of the populations can be very deficient in iodine. Iodine deficiency causes hypothyroidism. There is also a weakened immune system and increased risk of cysts, breast cysts, ovarian cysts, liver cysts, kidney cysts. So iodine is a very important mineral, not only for thyroid functions, but also for immune system. Glutathione deficiency, I mentioned that this is an intracellular antioxidant, the master detoxifier, and also immune booster. Now, if you are deficient in glutathione because it affects the cellular function, then the hormone synthesis can be affected. So it is not going to correct all hormone deficiencies, but having enough glutathione ensures that your cellular health is healthy. This is why when you optimize glutathione, there is so much of changes in you, including your energy, your sleep, the skin, and your immune system, and many other benefits. And why are we deficient in glutathione? Although it is produced in every cell in your body, from the time of conception, fertilization, cells must produce glutathione. If not, the cell will die. Why are we deficient? Because of this polluted environment, pesticides, chemicals, excessive amounts of sugar and refined carbs. All these deplete glutathione. And remember, just a note on diet, although we won't be covering everything about diet. Why do I always keep emphasizing on carbs, especially sugar? Is because when you burn sugar for energy, ATP, you create free radicals. When you burn fat, you do not create free radicals. That means there is no smoke. This smoke is what actually damages your organelles within the cell, including your mitochondria, your DNA. And this is why intracellular antioxidant is important. So the more carbohydrates someone eats, the more deficient the person is in glutathione. And are newborns fed? Of course no. Because how many mothers are breastfeeding? So at birth itself, you're creating glutathione deficiency because of sugar consumption. Magnesium, vitamin B, iron, selenium deficiency. Some are important for the synthesis of thyroid hormones. Some of the nutrients are important for the conversion of T4 to the active hormone T3. So if you are deficient in some of these nutrients, even if your thyroid gland produces T4, you are not able to produce T3 in sufficient amounts. Then, of course, autoimmune thyroiditis. And I always mention this. Autoimmune diseases, largely, if not all, caused by gluten. Gluten, leaky gut syndrome, and yeast overgrowth. If you control these, and with enough antioxidants and immune boosters, plus hormones, you control autoimmune diseases. And one of the commonest autoimmune diseases is autoimmune thyroiditis. So all these are the reasons for hypothyroidism, including having too much of reverse T3. Reverse T3 is opposite of T3. When you have reverse T3, it doesn't allow your T3 to work. So someone is deficient in thyroid hormones, you keep giving them thyroid hormones in increasing amounts, and they still remain symptomatic. You should think about reverse T3. So thyroid hormones boost both your innate and adaptive immune system. One of the way thyroid hormone helps you in your immune system is by converting carotenoids to vitamin A. Now, hypothyroid patients will have yellowish palms because they are not able to convert the carotenoids into vitamin A. So you have yellowish of the palms and the soles. And vitamin A plays a very important role in your immune system because it increases the macrophage activity. It increases the T cell count and function, and it activates both the innate and adaptive immune system. When someone is deficient in vitamin A, there is a deficiency in thyroid stimulating hormone, or the TSH. When, of course, your TSH low, you have low thyroid hormone synthesis. And vitamin A deficiency also reduces the iodine uptake. So if you are deficient in vitamin A, you are going to be immune deficient as well. But the thyroid deficiency creates vitamin A deficiency. Thyroid hormones increase the neutrophil count and function, increase the macrophage count and function, increases the natural killer cells, stimulates the maturation of monocytes into dendritic cells. So these are the ways that thyroid hormone helps in your immune system. So if you look at it, every step in your innate immune system is activated. And almost all sick and ICU patients can be hypothyroid. So a couple of things, if you really want to treat sick patients, you should measure their thyroid hormones, measure their cortisol level, measure the insulin level, and you will get it right in most times. And of course, you need to measure the vitamin D3 level. We don't do a lot of vitamin C testing because it has to be tested in white blood cells, is expensive. A surrogate marker for vitamin C is lipoprotein A. I'll tell you why I name health providers, or the world has become a cruel place to live in, is this. 6 months ago, until 6 months ago, the level of lipoprotein A was supposed to be less than 26.1. If it is above 26.1, it gives you an indication that somebody is deficient in vitamin C because it's a surrogate marker. Now it has been revised by, I think, the European Atherosclerosis Society. No reasons given. There is no change in the units. sorry, the units. But now it has been changed, revised to 120. So the normal level is 120 instead of 26. So if it is higher than 26, someone is deficient in vitamin C. Now, because this knowledge is getting around, if I revise the limit reference range to 120, that means I will be under-diagnosing vitamin C deficiency. This is gross injustice. So I asked the lab to give me a reason why they revised without a reason why. So they couldn't give me an answer. All they could do is to give me, send me a mail saying that this was the advice from the European Association of Atherosclerosis Society. So we will underdiagnose vitamin C. So anyway, coming back to what are the investigations you can do, one of the things that you realize is that in sick and ICU patients, most of them will be hypothyroid. So thyroid is a very important hormone. That is the reason why we name it as the master of orchestra. Okay. Now, another hormone which will be useful in the current pandemic. All hormones are useful, but one hormone that you can use in high doses when somebody is infected, having a viral infection, especially this kind of pandemics, and everybody is worried. And I believe that the fear is going to kill more people than the virus itself. This hormone is melatonin. Now, melatonin is produced by your pineal gland if you have enough vitamin D3, if you have sun exposure. Now, none of this is happening in most of us, including our children. The reason for insomnia is this, and it can also lead to other health problems. Now, you need sunlight, you need a healthy gut. And for you to convert tryptophan to serotonin, 70% of serotonin or more is made in your gut. So if you have gut dysbiosis or yeast overgrowth, you got a leaky gut syndrome, you're not going to be able to produce enough melatonin. If you do not produce enough melatonin, it's not only going to affect your quality of sleep, but it's definitely going to affect your immune system. So make sure you have a healthy gut, make sure you have the macronutrients and micronutrients and healthy digestive system. Make sure you produce enough hydrochloric acid. And you rule out candidiasis, or if you suspect candidiasis, it's okay to treat to have a healthy gut. Now, how does melatonin help in your immune system? I mentioned about cytokine storm, immune dysfunction and cytokine storm. Now, melatonin modulates the immune function, so you don't have overproduction of cytokines and you don't have excessive inflammation. It also increases glutathione levels. It is a very potent antioxidant. That is why it's used in high doses in cancer patients, even 20 milligrams TDS. Melatonin can actually help to reset your circadian rhythm. Most of us, this is already deranged because we sleep late, we don't have adequate sun exposure. So this is already deranged. So I'll tell you how to reset this, but going to bed early, having adequate melatonin is very important. Now, melatonin also increases the progenitor cells of macrophages. It also increases the progenitor cells for granulocytes and your natural killer cells. So those progenitor cells that are supposed to become your macrophages or granulocytes and NK cells, they can be stimulated if you have enough melatonin in your body. Aging people lose sleep. They have very poor quality of sleep. Difficulty in falling asleep, difficulty in staying asleep is melatonin deficiency. Melatonin also stimulates your CD4 and CD8 cells. The production and release of various cytokines from the T cell lymphocytes and the NK cells, natural killer cells, is enhanced by melatonin. So this is why you can take aging people, you can take melatonin to get a quality sleep. But when you are fighting a viral infection or an infection, then you can safely increase the dose of melatonin. The only thing about melatonin is you have to gradually increase so that it doesn't cause a lot of drowsiness during the daytime. But if you increase gradually, it doesn't seem to affect. And if you feel drowsy, all you have to do is just go out in the sun few minutes and come back inside, it resets itself. But having optimum amounts of melatonin is very important, not only for immune system, but because it also reduces the risk of nocturnal hypertension. Now, melatonin deficiency, one is aging, the other is sleeping at wrong time, late sleep, because your body has that internal clock and the circadian rhythm allows you to repair and regenerate between 12 midnight and 3 a.m. or so. And if for those who are sleeping late, you lose all these benefits. Stress affects cortisol. And if you are not able to produce cortisol, you produce the compensatory hormone adrenaline, which gives you the anxiety, the aggressiveness, the sweaty palms, and so on, tachycardia. And both high cortisol during the later part of the day or the adrenaline can actually suppress your melatonin secretion. So if you are not able to sleep, make sure you know how to manage your stress. Now, we cannot run away from stress. It's going to be part of our life, because without stress, I don't think so anything happens in this world, not at least with the modern living. But if you change the way you react to the stress, you solve a lot of problems. And the way to change how you react to the stress is the ancient way of relaxation and meditation. So that saves your adrenal health. High carb diet I've mentioned. Vitamin C and vitamin D3. Now, vitamin C, most of our vitamin C is concentrated in adrenal gland. That means it will use so much of your vitamin C. So if you are deficient in vitamin C, you are going to have a poor adrenal function. And the same thing goes for vitamin D3. Now, how do you actually sort out this blue light and EMF that disrupts your adrenal function, your melatonin secretion? Is ancient wisdom. Is grounding and sun gazing. Grounding means you stand on especially the grass in the morning, especially when there is dew. Stand barefooted. Let your feet touch the ground. And you must gaze the sun. That means you look at the sun, even if you don't want to look at it directly, at least look straight so that the sun rays penetrates your eyes. Now, once you have this, it resets your circadian rhythm. And for those who are finding it difficult to sleep, go out in the sun every 2-3 hours, just go out for 5-10 minutes and come back. Now, this with the sufficient amounts of vitamin C and vitamin D3, healthy diet, exercise, adequate melatonin to give you good sleep so that you can go to sleep at a time when you think it's the best time to sleep for healthy life. Then you save your adrenal gland. Melatonin deficiency definitely ages your immune system. It increases the risk of cancers, infections, chronic degenerative diseases, hypertension, especially nocturnal hypertension, and insomnia. Now, DHEA, this is the most abundant hormone in the body. It performs numerous functions in the body. It is closely connected to your immune system, your autoimmune risk of autoimmune diseases, diabetes, and cancers. It regulates both your innate and adaptive immune system, shifts the T cells towards the Th1 cells that will be beneficial, strengthens the innate immunity by suppressing inflammation. Now, many of us, those of us who take DHEA and DHA sulfate, many of us will realize that you slow down aging and you are much healthier when you've started taking this. Of course, This is not a hormone that is going to boost your immune system overnight, so you go and load yourself when you're sick. This is more towards prevention. Now, there's a connection between DHEA and a protein called ANGSA1. Now, annexin-1 or ANGSA1 mediates several anti-inflammatory molecules. Now, this itself is an anti-inflammatory protein, and it maintains homeostasis in the body because it maintains homeostasis for your cell signaling, your hormone production, your fetal development, and aging itself. Now, ANGSA1 is highly expressed in our innate as well as our adaptive immune system. And DHEA and DHEA sulfate both upregulate this ANGSA1. So one of the mechanisms of DHEA's action on immune system is by stimulating the ANGSA1. And this ANGSA1 is deficient in aging people. So this is another way how DHEA can help us. And taking DHEA increases your IGF-1, increases your monocytes, B cell numbers and activity. It increases your T cell activity, increases the interleukin-2, and also the natural killer cells. This is why we know DHEA performs very important function on immune system, prevention of autoimmune diseases, reducing the risk of diabetes and cancers. Deficiency, of course, seen with aging, both in vitamin C and D3 deficiencies, high carb diet I've mentioned, sleep deprivation, again EMF and blue light, and stress. It is increasingly seen in adolescents as well because of the change in the diet and lifestyle. DHEA deficiency can also be caused by synthetic glucocorticoids. We always have a problem of reassuring our patients that steroids are safe provided they are natural. Because the moment they step out of your clinic, somebody tells her, including doctors, hydrocortisone is dangerous when they are prescribing synthetic prednisolone, is this understanding. Now, synthetic glucocorticoids are not good for health unless they are meant for short-term use, because they suppress the adrenal gland besides other hormones. And the same thing is done by contraceptive pills. Low levels of C, D3, glutathione, and magnesium also cause DHEA deficiency. And remember, magnesium is very, very important for many of these hormones to function well, including your D3. Now, cortisol deficiency and immune health. Stress is a two-edged sword. You can have acute stress and positive effect on the immune system that helps you to control inflammation and infection, whereas chronic stress can be damaging because it is immunosuppressive. And of course, you have to differentiate between the dose of the glucocorticoids, whether it's natural or synthetic, and even natural cortisol, if you want to use, whether it is physiological dose or therapeutic dose. And cortisol, how it helps in your immune system is by increasing the glucose uptake by immune cells, and immune cells are so active that they need glucose for their ATP. So acute stress promotes cell migration, increases T cell mobilization, they increase secretory IgA, which is important, and decrease inflammatory cytokines. One of the purpose of cortisol or hydrocortisone is its anti-inflammatory action. Chronic stress, as I mentioned, it suppresses your T cell and natural killer cell activity, and it increases substance P that enhances the macrocyte cytokine production. So this is not good. If you have chronic stress, you are going to have a dysfunctional immune system. This would be the hormone that I'll be talking about today. Now, I mentioned that high intake of carbohydrate and sugar is a problem because it creates insulin resistance. Insulin resistance is where you overproduce insulin and the insulin is not effective. So you have lost insulin sensitivity. Insulin in healthy level is absolutely critical for health because it helps in the transport of amino acids, magnesium, and potassium into the cell. If you have insulin resistance or if you are insulin deficient, then you will have intracellular magnesium, potassium deficiency, and this is the reason why diabetic patients lose their muscle mass. But in high doses, it is very, very inflammatory. So this is the reason why if you see a diabetic patient, they always have poor response to an infection. They have decreased neutrophil functions, and they have also dampened macrophage function. So diabetic patients, if you look at them, they are more prone for infections. They're more prone for cancers. Infections including bacterial and cancer, viral and fungal. So insulin in small healthy doses is safe. In high doses is detrimental. It affects both the adaptive and immune health. At healthy level is necessary for cellular transport, as I mentioned, of all these essential nutrients. Glucose and magnesium are critical for cellular energy, especially the immune system. Insulin also supercharges your T cells, provided you do not have excessive insulin and insulin resistance. Loss of insulin resistance receptors or resistance affects your immunity by affecting especially the T cell function. So how do you optimize your hormone synthesis? First pillar of health is always diet, and always emphasize on carbs. A low carb diet eaten intermittently, that means low carb intermittent fasting diet, in my opinion, is a healthy way of eating. But try to avoid gluten and sugar, choose healthier carbs, avoid dairy, and be soy free as well. Regular water fasting or intermittent fasting is good for health. I'm not a strong proponent of keto diet unless I ask patients to do it for a few weeks to a month to reverse something they have or help with their chronic diseases or cancers short period of time. Then I always encourage a low carb diet eaten intermittently. Manage the stress well. Adequate sleep is important. Avoid or reduce the exposure to blue light and EMF at least at night, especially your children, please do so. And exercise. All this will boost your immune system. And the nutrients, which we can always discuss at another time, the vital nutrients will be glutathione, vitamin C, vitamin D3, minerals like magnesium, zinc, selenium, and iodine, vitamins A and